In a world where healthcare options seem endless, one thing remains constant: the need for exceptional quality care. At Whitney Rehabilitation Care Center, we understand that when it comes to your health, nothing matters more than receiving the highest standard of care possible. What sets us apart from the competition? It's simple: our unwavering commitment to quality and our exceptional staff.
Hi, my name is Robin. I am one of the MDS coordinators. I work with 3 other women who have multiple years of experience as well. I enjoy working at Whitney Rehab, basically because of the residents. They're the first priority for all. But the team that we work with, everybody from rehab, social services, housekeeping, laundry, everybody is part of a wheel, with the resident being at the hub and all of us being a spoke to make that wheel go round. The MDS coordinator, what we do is we will look at the residents' admission paperwork and we will create a care plan. It involves not only their dietary, but their rehab, their nursing, and we put together this care plan so that everyone will be able to care for the resident and meet all their needs while here at Whitney Rehab. Well, that's actually part of our role, because sometimes with managed care companies, it's very difficult to get the appropriate length of stay we need to get the resident back home at their independent level that they were at prior to their admission. So we coordinate with the case coordinators within UHC, Connecticut, Blue Cross, Cigna, Aetna, and we work very closely with them to ensure that the resident has a successful stay, gets the care they need, gets back to their baseline or as close as possible, and then return to the community with less chance of a rehospitalization. Yesterday was a very good example. We had a resident who really wasn't ready for discharge. However, they had been denied further coverage based on their being a managed care company. They had issued a last covered day, which we did not feel was appropriate here at Whitney Rehab. So we reached out to the case manager asking for more time. We, instead of just accepting that being the last covered day, we offered to give them more information. They, at this time, did not accept that. However, we worked diligently with the family member to create a letter for KEPRO, who is the company that looks over the Medicare cases and determines if the United Healthcare or Aetna or your managed cares denies inappropriately. So I'm hoping that they win this appeal so that they can have continued stay. In the event they do not win, what we did is we continued with the meeting to discuss what options they have should they get denied coverage so that they can still have a safe discharge at home. The MDS coordinators are basically an advocate for the resident to ensure a successful stay at Whitney Rehab and a safe discharge home.
Hi, my name is Fiona Nicholson. I'm the Director of Social Services and the Discharge Coordinator for Whitney Manor. So as the Social Service Director, I am part of a team where I'm meaning to address people's psychosocial well-being, their adjustment to the facility, and also as the discharge coordinator, I'm here to assist them with transitioning back to the community appropriately and safely. When I discharge people back to the community as a social worker in the facility, I coordinate services in the home. Upon admission, initially we do our first initial assessment, developing services like home care, any DMEs that have not been initiated in the home, and any other support services like Meals on Wheels and medical teams that might be needed to be implemented. From my experience for one of my patients who was a short-term rehab patient, he came to our facility living alone, definitely didn't have much support in regards to visiting nurse services, any cleaning services, but family was reporting that he was very not functionally appropriate to do those things on his own anymore, meaning cooking his meals, cleaning, transportation. So upon initial, we started working with him and trying to coordinate home care services that he was comfortable with, also looking at the services in the community that he could afford and would be appropriate for him. And if he could not afford it, looking at services that met those needs. In regards to reviewing his goals and his services, we found that he was actually appropriate for assisted living facility because he didn't require much medical assistance, but he did need some supervision in regards to home cleaning, companionship, and just overall socialization, which we saw was lacking by him living by himself and not really being able to be independent in the community. So we started working on getting assisted livings to meet with him in the facility, him doing virtual tours, and just overall getting him comfortable with the idea of transitioning to a new home setting that would be more supportive of his actual needs. And for me, it worked out very lovely. He now is living in an assisted living. He stays in touch with us as a facility, also has returned to us when he needed skilled services, and is doing exceptionally well over there. And we find it has been a benefit for him all around.
Good morning. I'm Dr. Joshua Green, the Director of Rehabilitation here at Whitney Rehab in Hamden, Connecticut. I oversee the occupational, physical, and speech therapists here at Whitney Rehabilitation in both of our long-term and short-term rehab care departments. So our day-to-day function is to evaluate and treat residents coming in from the community whose main goal is to return back to their homes in our local community, as well as take care of our long-term care residents who reside here at the facility, making sure they are at the highest level of independent performance. We have a very comprehensive discharge planning program combined with the functional abilities of the residents that are identified by the therapists that are treating them all individually, working with our social services and our nursing departments to make sure that people have the proper equipment and services that they need to go home and be successful once they are home. We are very patient focused here at Whitney. We take every person individually and look at their exact care needs and develop a program specifically for them. We don't have any cookie cutter programs here. Everyone is individuals and has an individual program. We go through a checklist of different levels of function for each person needs to be able to do to go home. Do they live alone? Do they live with a spouse? Do they live in an assisted living facility? So we take all of their unique situations and develop the plan that's best for them. Upon admission, a comprehensive evaluation program will be completed based on your function by any of our occupational, physical, or speech therapists to meet your individual needs. So our goal is to work with each individual on a short-term rehabilitation 5 to 6 days per week based on when you were admitted, to have the disciplines work with you daily to meet your needs. So fortunately, we have a team of occupational, physical, and speech therapists where our physical therapists are going to help you with your ambulation, your walking, your balance, your strength, your ability to do stairs, to get in and out of your home. Our occupational therapists are going to work with you with your daily self-care, your ability to prepare a meal, take a shower, use the bathroom safely, look at your environment to make any adaptations for equipment, such as a shower bench or shower chair, and then our speech therapists are going to help you with any cognitive challenges that you may be facing, or more importantly, if you've had a diet change or swallowing problem while in the hospital, to help you return to your normal level of function.
My name is Christina Gonzalez, and I am the admissions director at Whitney Rehab. I love the environment, I love working with the staff, and getting to know all of the residents. At Whitney Rehab, the admissions department works closely with medical professionals, with families, with our team to ensure that we are providing the highest quality care to all of the residents who come into our facility. Some of our daily tasks include referral review, working closely with the hospitals and nearby doctors' offices to assure smooth transitions to the skilled nursing facilities. We also verify insurances to ensure that residents coming into the facilities have the needed coverage and are not receiving large bills after a skilled nursing stay. We also work closely with families interested in viewing our skilled nursing facility to see rooms and our rehab gym prior to bringing their loved ones into our skilled nursing facility. Here at Whitney Rehab, our admissions department meets with families and residents daily to ensure they are receiving the highest quality care and to ensure they have no concerns while at Whitney Rehab. We want to assure that residents are having a great experience while at our skilled nursing facility.
I'm Donna Mignosa. I'm the Director of Therapeutic Recreation here at Whitney Rehabilitation and Care Center. My role as Director of Therapeutic Recreation is to engage our residents here in all sorts of leisure activities. We have entertainment, bingo, all sorts of games, physical games, mental games, crosswords. We do exercise, we do parties, all sorts of different things that would really stimulate residents who are here. It helps them emotionally, it helps them socially, so they know they're not alone in their experience here in healing. It picks up their morale and it helps them to heal faster, to know not only that they're not alone, but that they're engaging in something that they're happy, that they're utilizing their mental capacities, their physical capacities, and it just helps the whole process go along faster, and it really helps with enthusiasm and their morale. So when people first come to Whitney Rehabilitation Care Center, we'll meet them and we'll do one-to-ones on a daily basis. We'll ask them all sorts of questions about their life and really get to know them and find out what the story of their life is and how we can best engage with them. Our one-to-one visits are socially stimulating. It helps them to know that even if they're a little cautious about going out and meeting some of the other people here that we're really here for them, and we want to know what's going right, what's going wrong, what we do to make it better, and what they would like to do while they're here, whether it be something in the room that we can bring to them, or if they want to try to go outside their comfort level a little bit and come out and meet some of the other participants and have some fun while they're here. Recreational activities not only contribute to physical health, but stress relief and overall well-being.
My name is Trish Paolini. I am an RN nursing supervisor and unit manager. I've been at Whitney Rehab for a total of 28 years. And basically what I do is oversee the units, the charge nurses that are on the units. I deal with the other departments as well, the nurse practitioners, the therapy department, dietary, to kind of make sure that we're all dealing with the residents as a cohesive unit to make their stay here the best that it can be. What I like about Whitney Rehab and what sets it apart from some other facilities is that it's very family oriented. There's quite a few staff in the building that have been here for a very long time, and it's just a great environment to work in. It's very supportive. All the staff supports each other at all different levels. We all work together to give the residents the best care that we can. So it's not just nursing, it's, all the departments working together, and you don't necessarily get that at all facilities. The people that have been here for a length of time really get to know their residents and come to think of them as family. It gives us a better idea of their likes, their dislikes, their idiosyncrasies, because we all have them, how they like things done, where they like things put or not put. And when you get that length of time between a resident, our long-term residents, and our staff, they feel very comfortable with the staff as well because they come to think of us as family as well. We had a very lovely lady who'd been here a couple of times, and her husband was just the sweetest thing. And she had been out to the hospital and, came back to us again and had been now with us long-term. When she did eventually pass here, I was with her when she passed. We knew she was going, and to be there with her, holding her hand when she passed, meant a lot to me as a nurse. And when I contacted her husband to let her know that she had passed, and did let him know that I was with her at the end, that gave him a lot of comfort. When he came to get her belongings, he thought that her wedding ring was lost, and he couldn't find it amongst the belongings that she came to us with. So I encouraged him to reach out to the hospital where she was before our facility, and they were able to let him know that they had actually packed it in with her belongings, and it was just all wrapped up within her belongings. So he was able to, in the end, have her wedding ring, which just meant the world to me. We come at it from every angle. So as soon as they come in the door, we know why they're coming to us for a specific reason, but we also know all other disease processes that they have and issues that go along with those as well, and what their abilities are and what they can eat and drink based on all of them as a whole, not just the one reason that they're here, but the whole person. So we go at it from every angle, and we establish that care plan from the minute they walk in the door. We have a book that everybody's care plan is in that, and at any time a staff member can access that and see exactly what that resident's needs are and what we need to do to provide safe care to them.
Whitney Rehab creates a holistic environment to promote healing, resilience, and a successful recovery. Through social engagement and enrichment, Whitney Rehabilitation Care Center creates a holistic environment to promote healing, resilience, and a successful recovery. Discover the difference that quality care can make. Contact us today.